I had the mystery diarrhea button. So I was recording when the diarrhea was happening. And so eventually I was able to see the pattern where it became within an hour of taking AG1 that I would have diarrhea symptoms. So I was like, oh, okay. So finally now after this amount of time, I can see on a timeline that these things are occurring. And so I was able to figure out that I have diarrhea from just any kind of like powdered supplement.
You're listening to Biohacking with Brittany. I'm Brittany Ford, holistic nutritionist, wellness expert, and mama. This podcast is your space to explore the science, strategies, and soul of optimizing your health through every stage of life. Let's get into it. Hello, and welcome back to the show. I am thrilled you're listening. Welcome to all of the new listeners. I know there's a lot of new ears around here. This is a place where I talk about health and wellness and longevity and biohacking, a lot of women's health, motherhood, things like that. And I'm thrilled that you're here. Show's been going for quite a while now, actually. I think we're coming up on, it's definitely more than 3 years. I don't even know how many episodes, maybe over 370 episodes, something like that. And I am so excited, you guys, to be launching something really, really special really soon, which gives you no context, me saying that. So let me just say a bit more. I've been thinking a lot about my community and what I need and what you need, especially the women's health, longevity, and biohacking space that is honestly pretty limited. And I've been thinking about this a while because I always get these DMs and these emails and these questions from women who are looking to optimize their health. And honestly, it's very specific questions that they can't really find the answer on the internet, or they can't really find somebody who's talking about it. And so somehow they stumble upon me and they message me, and then we start talking about things. And I think we need to kind of make a space for this dialogue, for these women, and for all of us to connect. So I'm doing that. And I cannot wait for that to come in September. And I'm excited about it. It's going to be really cool. And for example, I literally got an email this morning. Someone sent me a message through my website. There's a little chat on my website. She's like, hey, I was looking at your fertility course and I was wondering if you talk about peptides. And I was like, no, I don't. I actually don't have a module on peptides for preconception health and fertility optimization. And then I was like, that is such a good question. That's something I should look into. And then I was just talking to her and I was saying this is something I'm going to cover on my podcast, maybe even in depth in a different way coming up soon, stay tuned type of vibes. And it's that type of thing of I think there's a lot of discussions, off the record discussions that women are trying to have, and there's not a lot of spaces for it. And that includes things like peptides for fertility. It includes things like vaccines, obviously, but also even much more than that. Things I've actually covered on this show. Things like, microdosing with psilocybin for postpartum depression, or just other things even enemas or detoxing, or very specific, nuance, almost like early adopter health and wellness topics that we're not really seeing a lot of people talk about. And that can kind of be a few reasons why. Sometimes these things are banned on the internet. You produce a podcast episode about it and it gets taken down and YouTube bans you and those types of things. And that's even true with things like silver, colonial. What am I trying to say? Oh my gosh, I just called it colonial silver. It's the end of the day here. Colloidal silver is every single YouTube video that I've put out about colloidal silver, because, my podcast gets published automatically to YouTube, has been taken down. And YouTube notifies me of false health claims. And so even something as simple as silver and, nano silver and how it can be used for mouthwash, ear infections, things like that, where women are looking at this for themselves or their kids, it gets banned. And so I think we need to kind of create a space where literally there's no topic that's off the table, and there's a little less regulation and more of a free space and a space that has experts in it as well. So a place where, I can say, hey guys, next month I'm having, who would you know? Like Dr. Taz, who's incredible. She's an amazing doctor in the States. Or I don't know, whoever it might be, they're coming on my podcast. Do you have any questions for them? Great. I can ask them your questions. That's the type of space that I'm creating. So stay tuned for that. I'm excited. I also just really am in a space where I want to connect more with my audience, but not in a one-on-one consultation space. I don't think that's my bread and butter, at least right now in my life. I think if I go and study functional medicine next year and in the years to come, maybe I'll open more of a formal clinic. But right now, that's not my bread and butter. It's not where I want to be. So yeah. So essentially, for you to take your note or your thing to think about while listening to me ramble is, if you're a woman who is interested in optimizing her health and longevity, and if you're a mother who's interested in those things, and you're looking to connect with other women who have the same values as you, and that might not be in your neighborhood, and you don't really know where they are, because how can you kind of talk to them other than like Instagram DMs or random Facebook groups, but then they're still regulated? I'm creating a space for you and I want you to be heard and seen. So stay tuned. Even just another example is raw milk. I just thought of that. Do you know what it's like to try and get raw milk in Canada? Don't even get me started. It's illegal. It's a black market purchase over here. Okay. I think I've told this story before of how I used to get raw milk in Vancouver. Yeah, essentially, I was in a Facebook group. That's what made me think of it. And I got hooked up with someone who was like dealing raw milk within my vicinity, kind of. And I went to go meet them to buy the raw milk, but you don't meet the farmer. You don't go to the farm. You go to a third-party person. So I showed up to this guy's house to buy milk with cash, because it has to be cash. There has to be no trace. And this guy comes out of the house who's in his like 50s or 60s, bald, bodybuilder, massive frame, comes out of his house. I'm sitting in my car trunk, like waiting for his guy, comes out carrying 2 massive jugs of milk, raw milk, brings it to my car, puts it in the trunk for me. I give him cash. We talk for 2 minutes and then I drive away. And it was like a drug deal. It was just ridiculous. And so that's what I'm saying is like, let's create a space where we can actually talk about this online. Let's connect. I know there's other moms out there who, can you give your baby raw milk? Let's have that discussion. That's what we're going to do. And that's what I'm creating. So that space is coming, and it's not going to be some sort of like $1,000 bullshit thing like that. No, this is an accessible space where we can all chat and learn. And I'm so excited to build this community for you. So please pay attention, and you know what I'm trying to say. Yeah, I'm just excited. And enjoy this episode today. This one was really cool. Very, very interesting. I spoke to Diana Kusunoki, who has a PhD, and she is a UX researcher and biohacker by her own necessity with her personal journey. And she has a doctorate in information science, focusing on high-stakes UX design, like emergency trauma, resuscitation displays. She's applied these skills on her own biohacking path, and we talk all about that in this episode. So she has an app. It's called Fulcra Dynamics, and it builds context, which is a personal data OS that aggregates your life data, visualize it through timelines and maps, and enables deeper self-reflection using AI, and puts your data into your hands so that you have autonomy and intention. And what does that mean, and why does this matter? So this app allows you to track different things in your life and connect the dots. So we talk about a lot of different examples, but say you're having, you're having constipation and you're like, okay, what's causing this? You can start tracking your food, when you're drinking water, when do you feel stressed? What's your energy? What are your supplements? Everything. And it takes AI and it uses it and says, okay, like today you said your constipation was, 7 out of 10. And this is what you did today. Maybe it could be this. And then it collects all your data points day in and day out and helps you identify potentially what the root cause could be for that, which is very, very cool. So it takes a lot of data and it puts it all into your hands and allows you to see the patterns and trends of things that you're dealing with. And it could be something more chronic, right? Like eczema. Eczema is a huge one. It could be anything. It's so hard to identify the cause with eczema for a lot of things, right? So if you start tracking like, oh, it flared on laundry day. Okay, maybe it's my laundry detergent, even though it says it's clean. Like stuff like that, I think it's really important for it. So if you're interested in that type of discussion of like UX design, AI software, and where we are heading in the healthcare space, that is for you. And this discussion is for you. A shout out to Biooptimizers, as always, my go-to for magnesium, digestive enzymes, and probiotics. That is my stack with them, you guys. You know that. Love them. Get 15% off using Biohacking Brittany. They just increased my percentage off, actually, which is wonderful. I love it. I take magnesium every single night. I take digestive enzymes. I mean, I had a muffin this morning. I took 4 digestive enzymes with it. Why would I not? Like, why would I not reduce the burden on my stomach, on my gut? Because I know I don't do well with all the dairy and the gluten and the sugar in there. So if gut health and digestion is important to you, you have to have digestive enzymes. Okay. It's like a staple, absolute staple. And for all of the moms listening and basically everyone listening, you better be on magnesium because the stress levels for moms can be a lot. I don't know if you can hear my kid and laughing in the background, but anyway, it can be a lot and moms need support. And that starts with magnesium. Most people are depleted in magnesium, so I take it every single day. So does my husband, so does my mom, so does everybody I know. Okay, enjoy this episode. And my retreat has also launched. I have a few women signed up already. We're going to Costa Rica in March. It is going to be epic. Something super, super special. If you're feeling called to join me in Costa Rica, book your spot now. There's been a lot of interest. So, and if you have any questions, let me know. You can message me on Instagram at biohackingbrittany. Send me an email, info@biohackingbrittany. I answer everything and I will catch you soon for another episode. Welcome back to the show. I am so excited that you are listening today. Today's a really cool episode. We are going to dive into women's health, biohacking, and data and wearables. And we're even actually going to talk about how a lot of the wearables on the market are really focused on men's health and men's performance and not necessarily reflective of women's health and how different we are as women biologically. So joining me today is Diana Kusunoki. I hope I said your last name correctly. She has been on her own health and biohacking journey, and we are going to dive into that. So welcome to the show.
Thank you so much for having me. It's a great pleasure to be here.
Yeah. So what kicked off your interest in biohacking in the first place?
Well, actually, I wouldn't consider myself like a hardcore biohacker. I ended up being more like a biohacker out of necessity. And it really started when I first contracted COVID. And this was back in like June 2022. And shortly after that, I got diagnosed with hypothyroidism. And that sort of triggered like a further decline in my health. And that's when I got really, focused on figuring out what's going on with my health. And then having to work with a lot of doctors to figure that out. And when I first got diagnosed, it was just like barely showing up in my labs. So the doctor is the one that caught it. And I had always like wondered maybe if I have it because my mom has hypothyroidism. And so she caught it. My doctor caught it for me, got me started on meds. And then, it was like right at the time when I first started getting the symptoms where like my hair was falling out, my nails were getting really brittle and had those waves in it. And the fatigue was just so extreme. I never felt that level of fatigue, like feeling like you got hit by a bus and you got to like take a nap at 12 at noon.
Yeah.
So that was my first experience with feeling like a lot of health issues coming on. And so, and then that started my journey. This is like 2022. So then shortly after that, there's some time to figure out like if these meds are working for me and doing labs like every 6 months to check in. And the 6-month checkpoint They're like, "Oh, okay, your TSH levels look fine now. You're kind of on the border to begin with, but you look fine." And I was like, "But I still feel tired. I
Yeah.
still feel the same fatigue." And so they're like, "Okay, well, we'll follow up again in 6 months." And then, so this is by the time it was like maybe January 2023. I followed up again with the fatigue, and they're like, "Well, maybe it's something else. So, because your labs look fine, you look fine." And so we, she was like, "Do you snore? How are you sleeping?" I'm like, "Oh, I think I sleep okay, but let me check the app that I was using at the time. I was using Sleep Cycle, which it records at night like the sounds, so things that could wake you up, the way you snore, your partner snoring could wake you up." So in there, I was like, "Oh, actually, yeah, I do have bits of snoring throughout the day or throughout the night." And
Mhm.
so we're like, "Okay, so let's try a sleep test." So she sent me home, um, and then they ordered a sleep test for me, which connects to your wrist. You wear it on your wrist, and then there's a lead that goes to your heart. And it says take home one. I didn't have to go into like the actual facility to sleep at night. So we did a take home test, and they found that I have mild sleep apnea. So then they put me on the CPAP machine, which is great. So I had a good experience with my doctor, and like being able to follow up with her and say, "Okay, I want to try this. Let's try that." So we tried the apnea machine. Helps a lot. It took like about a month to get used to. It feels like initially you feel like you're drowning, like trying to
Mhm.
catch your breath. I started to feel better when I wake up because I had fatigue immediately when I woke up, which is a sign of sleep apnea. So we kind of systematically uncovered that and treated that. And so I was feeling okay for a little while, but still some fatigue. And in the meantime, I had been trying different supplements and trying to get my health aligned. And I noticed over a period of time, I had been, on taking AG1 and different supplements, and I noticed that I developed, I'm going to call it mystery diarrhea, because I didn't know where it was coming from. So it would just be like really frequent until it became really frequent. And so what I did was I tried to record when I'm taking my medications and my supplements, and then when I have this way to record mystery diarrhea. So I have a little set of buttons that I put next to the toilet. And so I have a diarrhea button, and then I have other perimenopause symptom buttons. I have waking up to pee is one of those. Wake up to pee because I'm going to go to the bathroom. And then I had this really weird restless abs symptom. So, and I would end up feeling like I need to get up because it felt like
Oh, interesting.
my skin was crawling in my abs. So then I have to like really crunch really hard and kind of go to the bathroom and then try to go back to sleep. So I have those three buttons in the restroom because that's like where those symptoms tend to happen. So I had the mystery diarrhea button. So I was recording when the diarrhea was happening. And so eventually I was able to see the pattern where it became within an hour of taking AG1 that I would have diarrhea symptoms. So I was like, oh, okay. So finally now after this amount of time, I can see on a timeline
Yeah.
visually that these things are occurring. And so I was able to figure out that I have diarrhea from just any kind of like powdered supplement. And, these supplements work really well for a lot of different people. Like I even tried the Blueprint longevity mix, but it was just, they're great for everyone else or for other people. But in my case, anything that was really super um, strong and had a lot of content within the powder, but it was just like too much of a gut bomb. So I had issues with that. And that was something that I went to the doctor about, and they were just like, okay, we'll order some labs. We'll order you some, check to see if you have C. diff. And those all came back normal. And they're like, well, I can't really help you.
Wow.
And so part of that is they can only see you in this snapshot in time. What you tell them, they only see you based on your labs. And so I had to figure this out with my personal data, recording it myself, and trying to experiment, take it away, put it back, and then that's how you can figure stuff out on your own, and your doctor can't always
Yeah.
find stuff for you. So we had that. I had the stool samples were all negative, and then at that time they did some more labs, and they're like, okay, you see your triglycerides are elevated, and that kind of runs in my family. So I had been aware of that, and I had been elevated in the past. But recently, I guess with the thyroid issues, that became more elevated. And so my doctor was like, "Well, your cholesterol is fine, but do you want to what do you want to do? Do you want to try and change that with diet, or do you want to maybe try a phenofibrate?" So I said, "Well, I know this has been a long-standing issue for me, even with the supplements I take. Like I for a while I did really well on fatty 15 and doing different types of fish oils. I tried the fatty 15 was the best help, and then I tried to change it with diet, but then it still became elevated. So I said, well, as a preventative, I'd rather have a low dose maybe of phenofibrates. So I was able to work with my doctor in doing that. And it's because I had the data from it's been 10 years of me trying to changes. And I was like, well, after 10 years, I think it's been a little hard journey. So it was nice that I could work with her to adjust that. And then, yeah, and then over a period of time, still I was like, well, I have these weird perimenopause symptoms. I wanted to ask my doctor, was like, what is this? Like, what is this restless abs thing? Uh, Hot flashes and, my period being inconsistent. So, and my PCP, she was like, well, I really don't know. I think you should follow up with your gynecologist. And I think part of that is there's not a lot of research uh, just for women's health, and especially for menopause and perimenopause, and not a lot of support for women to understand, like, what are these symptoms? Like, are these actual symptoms? And everybody experiences them differently. So I think it becomes really difficult to, figure out if you're really experiencing them. So it's really important that you track them. And so
Yeah.
I started tracking with our app, like, okay, hot flash, when does it happen? It started happening kind of towards the end of my period. And, just being able to line those things up.
Ever snap at your partner over something small and then wonder, why did that bother me so much? Or maybe you're waking up groggy, craving sugar, breaking out, or feeling just off in your body, like your hormones are whispering or yelling that something is out of balance. If any of this sounds familiar to you, you are not alone. These are signs your body is calling out for support, and magnesium might be the missing piece. Magnesium is one of those non negotiable minerals, especially for women. It plays a critical role in hormone regulation, stress response, blood sugar balance, sleep, and even skin and muscle function. But here's the problem. Most of us are deficient, especially during high stress seasons. Hello, modern life, motherhood, and go, go, go careers. Food alone often isn't enough. So that's why I take Magnesium Breakthrough by Bioptimizers every single night. It's the only formula I found that includes all 8 forms of magnesium, including magnesium orotate, which specifically supports metabolic and hormonal health. I love it because it helps with deep restorative sleep, stress relief, and nervous system regulation, better digestion and fewer cravings, and supports my body through every hormonal phase, from luteal to postpartum. This is your permission slip to slow down and nourish yourself at the cellular level. Go to bioptimizers.com/biohackingbritney and use code biohackingbritney for 10% off. Even better, subscribe and you'll never miss a month. Plus, you'll unlock deeper discounts and free gifts as well. Trust me, your body, your mood, and your hormones will thank you.
And there's a lot of great apps out there like Flow that help you do tracking, but they're also siloed. So that data is within the app, and you're not able to compare it to maybe your heart rate or
Mhm.
events. So, what was I doing that day that may have
Yeah.
made that a little bit more prominent for me. So I started tracking all those things, went to the gynecologist, and she said, uh, the only thing that sounds like really perimenopause, because I'm on a birth control, is the the abnormal timing of my periods. So um, she suggested going back again to my PCP to figure out my thyroid again. So like a whole thyroid panel again to check, and it actually looked normal. And I was like, really, I really feel like it's the same type of fatigue, and it's been hitting me a lot harder, maybe because I am going through some perimenopause. And so my doctor, she was like, well, you seem fine. And I'm like, well, I don't feel fine. And this is my body trying to tell me that something's up. And I think, a lot of times women's women's health symptoms are often dismissed by their doctor. Women are also like 30% more likely to get misdiagnosed. Uh, and my doctor, she's really great because she had been listening to me, and we tried a lot of different things. We did kind of like a big loop to make sure we're covering all our bases. And now coming back to this, I was like,
Nice.
well, um, it's been 3 years since that point when I was
Wow.
diagnosed. So so it was a long loop, but she's like, well, your labs look great. So I'm not really sure. And so I did something that I shouldn't recommend to anyone. I'm also not a doctor, like I'm a medical doctor, but I did um, experiment with. So I track this. So I was like, okay, what if I upped my medication a little bit, just a couple of days, and I actually started to feel a lot better. And I think it was within the safe range because she had initially when she diagnosed me, she set me on a lower dose of 50 micrograms. But so I said, well, I tried because when you're kind of in the position of having gone through all this stuff, the
Yeah.
experimenter
You're
in
willing to
me.
try it. Mhm.
I was like, well, hey, and I can try a couple days and see what happens. So I took an extra half dose, and I was starting to feel
Mhm.
great. So I went back to my doctor and I let her know. And she was like, "Well, actually, maybe that'll work for you. She prescribed it." So she ended up actually prescribing it to me officially. And I have a prescription for 75 micrograms. And she said, "Okay, let's follow up in another few months to
Mhm.
make sure that you're not um, at too high of a dose." So we were able to experiment in that way. And part of it is because I was able to advocate for myself and say, I have this data. I've been tracking my symptoms. I feel better when I do this. Can we try this together? And uh, I think that's sort of an unusual doctor patient relationship
Yeah.
because most of the time you only get 15 minutes with this person. They don't really follow you throughout your personal health journey. They see you in a
Yeah.
snapshot of time. You only have so much time with them. But it is true that you should come prepared whenever you're meeting with your doctor with all the data and all of your symptoms. Sometimes that's really hard to remember when you have a lot of them.
Yeah.
And so, and another thing that I started to do that, is a little unconventional and like, I shouldn't necessarily recommend this, but like taking the results from my labs, putting it into a chat GPT and trying to
Mhm.
understand what it really means.
Yeah.
Because the doctor is going to just be like, oh, you have elevated this and that.
Yeah.
And then you don't really get a chance to understand it for yourself. So ChatGPT can really be a good partner in helping
Yeah.
you understand what you're going through, being able to match up the symptoms and say like, okay, well then if we have to do any interventions, these are probably the likely paths that I'll have to
Mhm.
go through, and then you'll be a little bit more prepared when you go in to discuss with your doctor. And because of that, like when I talked with her about my hypertriglyceridemia, I was able to understand like, oh, I can ask for a phenofibrate, which doesn't
Right.
involve all of the things of a statin. And so I think that was really helpful. Um,
Right.
so it was
Yeah.
a long journey, like a
Mhm.
long loop. And really, I would love to be able to shorten that loop for a lot of other people because they have the tools to do the tracking and then to advocate for themselves. Because it can be really difficult to figure out these things by yourself.
Yeah. Yeah, absolutely. I think it's really cool that you just took the time to kind of figure it out and connect the dots and see like, oh, the AG1 is actually causing diarrhea. And oh, like these are my other, perimenopause symptoms that you might be dealing with. And what does that actually mean for you? And I love what you said about ChatGPT because I do the same thing. Like I put my labs in, I put my kids' labs in, and I what does this mean? What do I do with this information? I think like that's the one of the biggest hurdles that I've had is you get all this different testing done now, which can be so helpful. But when they give you the testing back, if you don't have like a medical background, you actually don't really understand it. You get all these values and you're like, this is the normal range, but this actually might not be the optimal range. And is this applicable for women, a woman my age where I live? So there's so much context that can often be missing, even when you do get data back from any tests through your doctor, or even at home.
Absolutely, and it's really just the snapshot in time. So
Yeah.
that they're only looking at your labs maybe every 6 months. If you're lucky, you get to get it every 3 months, and they don't see all the in between and all the context of the in between your life and what you're doing. And
Mhm.
so having all of your data in one place, and being able to provide that context, because data really is just a number. But when you provide the context of these are the symptoms I'm experiencing, this is what I've been doing. Like this is my exercise routine now, and then having a GPT be able to take in that context into the window, and then being able to analyze with a little
Mhm.
bit more about you, because really, like the GPT doesn't know anything about you until you give it that context. So
Yeah.
there's ways now to connect up your data to a
Yeah.
GPT and get that context, and you get that it feels more personal.
Yeah. Oh, definitely. So talk to me about the platform that you are a part of. And obviously I understand now like the full mission and vision behind it. But for the average woman listening to this podcast episode who says like, I have these symptoms, my doctor says they don't know what's wrong. Like, how does your platform kind of fit there? And like, how could it actually help them?
I really like to think about the way that I designed this app is to help empower women, like people like me who have these things that they're not going to necessarily have help with. Like maybe you don't have a health concierge to help you with these things. So I'd love to be able to support things like what's now called spike tracking. So women can record their symptoms. So we have this thing called annotations. So you're able to create an annotation, and there's different types of annotations. One is a moment. So this is kind of like this is maybe like a symptom. You want to make a note about your symptom. A number. So maybe you want to input your maybe like your waistline or oh no
Your weight or your
your
BMI?
yeah your weight or BMI. Something you want to track that's not necessarily going to be like automatically tracked for you. Although there are things like scales that can do that. And then we have other things like a duration. So maybe you want to say, oh, I meditated for 10 minutes. I can track myself during a time. And so to provide different ways of tracking things that are really difficult to track that's not captured by a device. So like
Yeah.
I have an Oura Ring, I have an Apple Watch, and my phone does a lot of things to track what I'm doing, like location and
Mhm.
calendar. But it's not capturing the data that's coming from your brain. Like there's no one that's able to like telepathically put in data into any type of device. So we want to make that process a lot easier for people because it is hard. It's hard to remember to remember. So tracking, so we have annotations, and then now there's a way we're going to release this pretty soon. We're going to have a way to do reflection, which is basically like a survey of all the annotations. So you can schedule it. And the one thing I'm proud about reflections is that not only can you schedule it for a particular time, so maybe you want to have like, and at the end of the week, you want to have a weekly anxiety review to see, how you did in the last
Mhm.
week. Schedule that. But there's also like different ways of tracking called stochastic polling. So this can we can allow people to schedule, but it's random. So you can be polled randomly throughohout the day about maybe this is like energy. So you want to track your daily energy. You can have the reflection poll you at random times during the day. You say, oh, maybe just in the morning and afternoon, or different times a day. And so what happens when you do stochastic polling is that the you're able to extrapolate generally what you do throughout the day without having to be super accurate. So you're able to, generally understand your energy throughout the day
Nice.
because you have this stochastic polling. And it's not just going to be like once a day. So you can say with more confidence that this is more accurate. This is generally how I'm feeling. So we have that feature now so you're able to remember to track and gather the stuff that really gives context to all the data. Because what does 10,000 steps really mean?
Yeah.
You can say, I went hiking and I enjoyed um, seeing the scenery, and then I felt a lot more connected to nature. And like you can add that
Mhm.
context to the data and say why I feel better now.
Yeah. 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 Actually, I love that. Like, and I just saw an article recently that basically debunked 10,000 steps. And it's so funny that like we have like, held on so tight as a society to that number when again, it could be so different for everybody. Um, and like I have, a Garmin watch and it gives me step goals every day and it kind of like bases it off the days before and my sleep, but it still doesn't base it off of like how I'm actually feeling or my
Mm.
life or my lifestyle or my workouts. Like there's still aspects of things there that are definitely missing where it sounds like your app, I could actually kind of figure that out a bit more and say like, today I did 10,000 steps and we did the random energy tracker throughout the day and my points were all higher. Then the next day I only did 3,000 steps and I sat at my desk all day and I did the random energy tracker and it was much lower. Like that's the kind of thing that is actually much more practical and much more useful.
Right. And then that's great if you're kind of on your own, but if you have the opportunity to work with someone like a coach, you're able to send that data to your coach so that they have the context for deciding what kind of workout you should get today. If you're fatigued, maybe they'll have like a different type of workout so that you're not pushing yourself beyond the limit. So I
Mhm.
think that's especially important for women because uh, overworking can also put you into like a greater form of stress. So having that context really helps them tailor that
Yeah.
experience for you.
Yeah. I'm so curious with your background and your expertise. Something I've been thinking about lately is the role of doctors in the future and the role of like functional medicine doctors. I don't know if you know what a functional medicine doctor is, or a naturopath, or basically anybody who's not a medical doctor. I wonder about their role as we use more AI in the medical realms more and more and more. And we can do so much at home now, so much at home testing. I can put my results into ChatGPT. I can use your app to connect all the dots and see how I'm feeling. And then I think like, will we get to a point where we actually don't necessarily need a health coach or a fitness trainer and we can just do everything on our own? I'm curious with your background, like, do you see that as a future or do you think there's still a role for those practitioners?
Oh, I absolutely still believe that there's a role for practitioners. And the the way that I designed this, I didn't want necessarily to supplant the
Hmm.
medical doctor or coach. I think it's more to support them so that they have the real context of your life to get you a really ultra tailored program. And I think they're going to be really the ones that are able to interpret the nuances of your life and your data, and then provide a great practice for you to change whatever it is that you're trying to do. And part of those practices can be we could support those coaches and doctors to help you get aligned with that practice and then put them into reflection and see. I don't want to call it compliance, but like how well you are adjusting to that program for you. And and then by having that feedback loop, you're going to have a faster experience of improvement because you have they're a closer channel. So it's not like you're waiting 6 months for a lab. You're going to have that professional that really knows you, is able to see your trends in a shorter uh, feedback loop. And I think that's
Yeah.
where health is going to go. And I hope that a lot more people are going to have access to that. And for the people that don't really have access to things like that, I'm hoping that we're still able to provide the way to collect data so that you can at least use an AI chatbot to figure out
Yeah.
some things on your own and supplement whatever the doctor's not able to give you, the attention that they're able to give you. So I think, yeah, there's going to be a mix of both. And I really hope we align on a future where everyone has that personalized care.
Yeah. Yeah. I think you're right. I think the role of the human interaction between a practitioner and a patient is always going to be there. And I think that's because humans just want to talk to another human. Like, I don't want to sit down with an AI bot and be like, here's my whole health history for the last 30 years or whatever. But I think it's really cool if I track my period for the last 5 years and it can say, hey, Brittany, like your average luteal phase is shorter than probably what it should be or something like that. Like, so I think there is this beautiful blend that can happen. And I think like something like your app and just AI in general can kind of take away a lot of the um, tedious grunt work that a lot of practitioners do. And so then they can maybe charge less, I don't know, and make it more accessible. Maybe they have more time now for more patients because all of the things that took forever, writing up notes and reading all this stuff, now we don't necessarily need to do as much anymore because AI can just do it for us.
Yes, exactly. And that's part of the thing that we want to do to help people create their um, database of their whole life and their health journey. Because then,
Yeah.
when you do intake forms in a new doctor, and you're not always going to necessarily be with the same doctor. You might have to go to specialists. You won't have to repeat yourself. So you have all of this data, and then they have access, and then maybe eventually we'll have a way to track all of the interventions that happened and your trajectory on that. So yeah, I think there's going to be a lot of ways that AI and data collection is going to help, especially when it's all in the same place.
Yeah, that would be incredible. Because even one of the things that I struggle with right now, and I think a lot of people do, is when you see different types of practitioners and then they make their notes and they make their strategies, but they don't talk to each other. So I would love for my like chiropractor and my osteopath and my naturopath and my massage therapist, especially when I was pregnant, like, and I was trying to do so much because I was having whatever symptoms. Like, if I had a portal or an app where they could all put their notes in and like see, oh, like your osteopath said this, like, okay, let me factor that in. Like, it would just be amazing if we could have our own health central, one location for everything, prescriptions, supplements, like, but man, it's still a huge mountain to climb for us to
Yes,
get there.
absolutely. And yeah, one example is I went to a dentist because I've been having trouble with my TMJ, and then I've been grinding, and he even noticed when I went for my checkup, he say, "Well, you have this mole on your lip that you should go and get checked." So, but I had to be the one in the middle to coordinate. Okay, let's go to the dermatologist and get that checked out. Oh,
Yeah.
let's try and get TMJ imaging so that he can make me the correct appliance. And the dermatology appointment was easy, but trying to get imaging done through my PCP was difficult because she was like, "Well, your health insurance doesn't cover that. So
Mm.
you're going to have to try to figure it out on your own. It's not covered. So I can't make that appointment for you." And then I had to try and go to a separate clinic for them to try and do the imaging. And they said, "Well, we don't do this imaging," and gave me the back and forth and said, "Are you going to pay out of pocket?" I think they were afraid that I wasn't going to pay out of pocket. I was like, "I'll pay out of pocket so I can feel better." I just really want to know what's going on and get the correct appliance. So there's a lot of, personal coordination you have to do just to get a couple of things checked out.
Yeah. Yeah. It's ridiculous. Um, is that something that you could potentially put into your app at one point? Is like have a practitioner part of it? I mean, I don't even know what that would look like because I also think about all the legal aspect of it as well, of like privacy in terms of everyone's data and like in their practice. Like, I don't know how that would work.
Right. Yeah. I think there's probably a lot of HIPAA compliance issues that
Yeah.
we're going to have to face. Uh, but at the moment, like you're able to share your data because it's yours. Like you own this data.
Yeah.
So you can share that with a practitioner if you like. And so I think, but when we start getting into like a whole system, we're trying to like maybe replicate what Epic does and have this to try to get a universal medical record system, which I don't think has ever been achieved in the last, I don't know, 20 years that we've tried to do that. So that's always difficult. And I think the onus is still going to be on the patient to be able to manage those records. And so we're going to try and make that a little bit easier so that you can
Yeah.
transfer that knowledge a little bit better.
Yeah. Yeah. I think you're right. I think it's a huge hill to climb. And I think if it's on the patient, then it's easier. But at the same time, it's also frustrating that it has to be on the patient because I guess it's like both. It's like it's good because you have a sense of responsibility for your health. And I think people need that instead of outsourcing it and being like, oh, like I'll go to the doctor and they'll fix me. Like I think it's good to be like, um, my health is a reflection of my choices and my daily lifestyle and my genetics partially and things like that. So I think it's good to have that sense of responsibility. But at the same time, you know, it, I look forward to the day whenever it does happen that we can have everything be integrated because then I think the way that we can heal would be so much faster. Um, but I don't know when that's coming. And yeah, at least we have your app as a step forward.
Thank you. Yeah, and it's going to be really difficult. To get information sharing in a private way. I think it's going to be very
Yeah.
difficult if the person doesn't own their data. And I think no, yeah, I think that's going to be really difficult to figure out.
Yeah. I think so too, but it doesn't mean it's not possible. Our current healthcare system isn't great and it's kind of failing us. So I think there is demand for other answers. And it's just like, how do we make that work? And the world is changing so rapidly with technology that like, who knows 20 years from now what we're going to be doing. Like, I mean, even 10 years ago, there's no way we would have been like, oh, you're in Hawaii, I'm in Toronto, and we're on a call right now talking about health, a video call. Like, I don't know if I knew that was possible 10 years ago, 15 years ago. And the audio is going to be great and the video will be great. Like, yeah, you know what I mean? So who knows?
Right. And I really look forward to being able to make data shareable so that, if you are a
Mhm.
caretaker, that'll be easier because I've seen like my mom and
Mm.
my dad go through that a lot with their parents and siblings. And then for advocating for people who aren't able to advocate for themselves, or, maybe enabling a health advocate to be able to advocate for you because they have the data. So hopefully that's in the future.
I love that. I love that. Well, if people are listening, or especially women, if they're listening to this and they want to try this app and connect with you, where can they find it? And I will put all the links and everything in the show notes.
Great. You can find us on the Apple App Store. It's Context by Fulcra, and we have the app there. And we also have our website, fulcra.ai. You can find us there. You can find me on Instagram, Dr. Kusunoki as well.
Cool. Amazing. Thanks. I will put that in the show notes. And thank you for coming on the show. This is so interesting. And I can't wait to see what comes with your app and how you guys blow up very soon.
Thank you so much for having me. This was a lot of fun. Thank you.